Leading things off on November the 3rd, a discussion will take place on racial disparities when it comes to end-of-life care. Joining us with all the details, we have Michelle Drayton, the Director of Hospice and Palliative Care Outreach, Visiting Nurse Service of New York, and Andrew Ingall. He's the producer of Regimen End of Life, and we welcome you guys to the show. Now, Michelle, you've been here before, and we had some serious discussions on end of life and some other things dealing with an area that you're working in.
Absolutely.
Now, today we're talking about the disparities, right?
Right, and we're talking about it through Reimagine Life, which is a wonderful initiative that's sparking conversations all over the city about end of life through very creative ways and different ways. And on November 3rd, we're going to be talking to two experts, Dr. Jessica Zitter and a pastor, and myself. We'll be having a discussion about why are there disparities in access not only to end-of-life services, hospice and palliative care, which we discussed before.
Yes.
Hospice is a part of your Medicare benefit. There's really no financial barrier. So why is it that many African Americans and Latinos and Asians and Native Americans are not accessing the services? And we'll be having a discussion about that.
You think it's a scare? You know, like palliative care, or going into that area, oh, this is the end of life, what do we do?
Right.
And they just freeze.
Right. Well, I think that that's part of it, trust. One, it's a frightening topic. We all want to live as long as possible. But at the same time, there's also issues within the system, within the healthcare system, as to why that is not presented to people earlier. And we're going to be talking about some of those things. And how do you get the best care for your loved one? How do you get the best care for yourself? We're going to really provide people with some tools and resources that they can take away and begin having that conversation early before your loved one gets really ill or terminally
it's inevitable.
Ill.
It's coming, so why not have that discussion? Just sit there and just throw it back and forth. Some people say, I don't want to talk about
Absolutely.
that right now.
They're frightened because if they talk about death, it's going to happen to them immediately. So let's postpone this. It's not a conversation that I want to have right now, but we're finding ways with Reimagine, working with faith-based organizations like Riverside Church, where this event is taking place on November 3rd. We're working with cultural organizations. We're working with film festivals. We're doing stand-up comedy. Anything to get people to begin that conversation.
Yeah, and end of life is all a part of life. It's a circle. You're born, and then nothing lasts forever.
And there's another part of it, Bob. I mean, if you're not accessing services when you're terminally ill, on the other side of that, we're also not accessing preventive care services. So, in terms of dealing with chronic illnesses, things that we're all commonly familiar with, diabetes, hypertension, heart disease, pulmonary disease. These are also chronic diseases that we're living with on a daily basis, and we're not necessarily accessing the care. We're oftentimes accessing the care very late, or we're not even accessing preventive services. So we're going to have a conversation about why that is and how can we actually change that dynamic.
And so you're going to have all of this under one roof. Where's it going to be? How's it going to look?
The beauty of Reimagine is that it's taking place across the 5 boroughs. We're meeting people where they're at, whether that's geographically, spiritually, culturally, and the Bronx in particular. We have this wonderful anchor partner, Montefiore Hospital, the Children's Hospital of Montefiore. Talk about death being this taboo topic. When you bring children into the conversation, that makes it even more taboo. Especially with what's going on now, with Pittsburgh, with Kentucky. How do we talk to our kids about death? So Montefiore is doing this beautiful event where they're linking remembering children in the Bronx who have died with organ donation so that those children can live on.
Yeah. Well, what do you tell people that say, that conversation is too morbid for me? I don't want to talk about that.
I would take them to a Reimagine music event. I would take them to a Reimagine stand-up comedy event. We have to meet people where they're at, give them an opportunity, and do it step by step in a gentle way.
We call it the identification technique. Let's see if we can meet you eye to eye. We can identify with you. You can identify what we're talking about. This is a thing that's inevitable, and we have to prepare for it.
Absolutely. And if we prepare for or discuss death, the inevitability of death, the likelihood that we are actually living a better life and that we actually honor and cherish the life that we're leading is greater. So, there is a clear benefit to having that discussion and really understanding the dynamics around why we're not getting access to those services, because the services are essential when someone is sick. All of the comprehensive care that comes with it, that's often done in the home. These are vital services that we're all going to be looking to actually receive. You
Yes.
don't want to wait until it's too late to be able to understand what's available to you and how to get those services.
Okay, so what should we start doing to access all of these services?
First and foremost, you have a medical home. You make sure that the physician or the nurse practitioner, whomever is your provider, that you trust them. You build a relationship. You understand what's going on in your own body. You start doing your own research. And the most important thing is that you have a discussion. You have a provider that is giving you the pros and cons to certain types of care. And when it's appropriate, they're saying, we need to increase the level of care that your mother or that your dad is currently receiving. They may very well benefit from this very comprehensive service called hospice.
Yes. What about the caregivers? They play a very important role in this area here.
Essential.
Caregivers, in particular, need care themselves.
Yeah.
You can easily burn out when you're taking care of a loved one, so
Yes.
we're doing a lot of programming during Reimagine Week to focus on those caregivers and to make space for people who are grieving as well.
Excellent. All right, so you have these different locations. So where can we access these locations?
Well, first, I would suggest you go to our website, which is letsreimagine.org, and there you can search for events by day. You can search for events by topic. We have a whole sub-theme on inequities at end of life, racial disparities. We have programs focusing on stigma for people with HIV. You can look through that website and find something that's meaningful to you.
Yes. Racial disparities. What are people missing here?
It's a
I
complex.
know we touched it in the beginning, but
Yeah,
this-
Bob,
this-
we've talked about this, a number of times. It's a complex issue, and it's not only on the side of end-of-life services, it's also about preventive care. And it really ties into issues of trust. It ties into maybe lack of insurance or being underinsured. I mean, the whole frame for this conversation is a bigger healthcare conversation. The Affordable Care Act, the fact that you had 45 million people who were uninsured in America, and now, that's down to 31 million. So, the politics of that and making sure that people have the proper insurance. And then understanding, who your provider is and forming that relationship with providers and someone that you can trust so that you can have the conversation. But the disparities are really real, and the gap is big, and it has implications for the rest of your life and the quality of your life.
And Michelle, I'd add to that, it's important that medical schools are training on implicit bias for those
Absolutely.
providers.
Yes.
Absolutely. Diversity in medical schools, in health careers, making sure that the people who are at our hospitals and our nursing homes and other healthcare facilities look like us, that they can relate to us, and that the goal is that we live the best life possible, right?
So once again, it's going to be at Riverside Church.
November 3rd at 2 o'clock, Racial Disparities at End of Life with Michelle Drayton and our two speakers. And please go to the website, letsreimagine.org, to attend other events this week.
And it's free.
Yeah, and we thank Ms. Ricketts from the Harlem Chamber.
Thank
Harlem
you.
Chamber of
Yes,
Commerce.
they are collaborating with us. Patricia Ricketts, Lloyd Williams,
Yes.
they're involved, they're engaged. Hopefully we can get our churches out, people from the Bronx. The events are amazing under the Reimagine Life umbrella. Just exciting events and really sparking a very, very important conversation.
And Andrew, that website again is
www.letsreimagine.org.
letsreimagine.org. All right, wonderful. Thank you guys for coming.
Thank you, Bob.
It's a
Always a
world
pleasure.
of information. You got to continue to share.
That's-
And maybe afterwards you can bring some pictures and roll some videotape and talk about it again.
That'd be
Great.
great.
This needs to be spoken about
Discussed.
more often.
Thank you
Yes.
for giving us the opportunity.
Yes, you're always welcome to come back.
Thank you.
Andrew Ingall, producer of Reimagine End of Life. Give him a big round of applause. Michelle Drayton, director of Hospice and Palliative Care Outreach, the Visiting Nurse Service of New York. Thank you guys so much.
Thanks,
Thank
Bob.
you,
All right.
Bob.
Thank you.
We've got to take a quick break right here, but stay tuned. We'll be right back with more Open next.